I'm Dr. Vandna Jerath. I'm an OBGYN physician in Parker, Colorado, and I'm super excited because this is my very first Periscope. So I'm really glad to have you joining me today. If you're here, please say hello so that I know that you're visiting, and definitely tap the hearts. Hello, Reek Torman. Glad you could make it. Glad you could join us. I'm actually sitting in my office tonight, and I thought, gosh, I just want to put out some valuable advice out there. Hi, Lexa. Glad to have you join me. And I wanted to put out some good advice tonight for people who want to have productive appointments with their doctors. So, as I said, I'm an OBGYN physician. I have my own practice called Optima Women's Healthcare in Parker, Colorado. And so I want to talk about often when you go to the doctor, you feel overwhelmed and you forget all the questions you were going to ask, and you leave there and you don't remember the directions you got or what information you got. And so I want to kind of give you some tips so that you can stay organized, and you can even keep your doctor organized and on time to have a productive appointment. And then ultimately you can be an empowered patient. So let's get started. Hopefully some other people join us here today as well. Please feel free to share. So, swipe up or swipe across to share this Periscope with others. So let's start. I'm going to start with number one. My first tip is, of course, to be on time. And I know when you go to the doctor, it's kind of like a hurry up and wait scenario. You go to the doctor, you're sitting there and waiting, and I understand that, and that can be very frustrating. But if you are on time, your timeliness will be appreciated, and it will be valued, and it will help the doctor stay on time, because if you believe it or not, we actually do want to stay on time, and we do want to see our patients in a timely manner. We know that your time is valuable, and we know that it's difficult to squeeze in doctor's appointments in your day. So definitely try to be on time, and that'll actually help your doctor be on time as well. So number two is bring your current medication list. This is really important. So whether you're the patient or you're going into an appointment as the patient advocate for a loved one or a family member, then bring the medication list. Some of the elderly people can be on a large number of medications. For example, my father's on about 25 medications, so I keep an up-to-date list for him all the time. But, type out a list, put your dosages, make sure you have the right names of your medications, because if you go in and tell somebody you're on a little blue pill, the first thing to think of is Viagra instead of anything else. So you definitely need to have a medication list. This will be a lot easier for your doctor to actually be able to take care of you. Plus there's interactions with medications, so then they can figure out what medications are appropriate for you as well. Okay, so number three, know your family history. It's really important to know your family history, in particular anything related to cancers or genetic history that might affect your health. So try to research that before you go to your appointment, and that will help your doctor as well. Number four, have a list of questions to ask about your health. So this is really important, because lots of people have lots of questions before they go in to see the doctor, but then they forget their questions when they get overwhelmed at the appointment. So have a list, and it's a great way to keep your doctor on task and keep them focused and keep yourself focused so that you can get all your questions answered. This is really important. Okay, so number five is do your research ahead of time, and everybody loves Dr. Google and WebMD, and so that's okay. I think that's fine to do your research. Take a look at the internet, see what you're thinking about, see what your symptoms are. Just don't walk in there and think that you have the worst ailment in the world, because that's not what's going to happen to you, more than likely. So research your symptoms. Think about what you think it could possibly be, or what's going on, or how you feel, and try to be realistic about it and share that with your doctor. And I think that's appropriate, and that's okay. I know some people think, oh my gosh, here's my patient researching on the internet, but I actually welcome it. I think it's great, and I think it can really make an appointment productive. All right, number six, I think it was very important for you to bring your medical records, especially, hi JP, it's very important to bring your medical records with you. So you should bring those from another physician, or if you're getting a second opinion or a consultation. Keep in mind, it takes a while to process records, so please give your doctor's office time to send those records out on your behalf. That usually 30 days in advance is appropriate. So plan your appointment accordingly, and get those records and bring them into your appointment. They can be put on a disc, they can be sent to you electronically, they can be faxed. There's lots of ways to get that information to your doctor, but in order to make your appointment productive, it's really important for your physician or healthcare provider to have that information at the appointment. Oftentimes I see new patients and they've had ultrasounds or CT scans, and then I don't have that information. So it's really hard to offer an opinion or even offer advice if I don't have that information. Okay, so next, number 7 is to provide clear communication. It's important for you to share your expectations for your appointment, what your expectations are. Are you in for a second opinion? Are you in for medical advice? Are you in for a medication? Give your ideas about a plan, and that'll help streamline the process, and it'll help keep your doctor on task again and keep them focused on what is most important to you for that appointment. Keep in mind that if you have a long list of issues, they may have to be broken up into multiple appointments. They can't always be addressed in one appointment. Next, be flexible. Number 8. Be flexible. Sorry, I hope you're not seeing that on my screen. Be flexible and open to ideas or options that your doctor might tell you. So a really good physician or healthcare provider is going to tell you the full range of options for you, the risks, the benefits, the alternatives, the potential complications, and then they're going to try to help you make a fully informed decision on your care, on your health care, and what needs to be done. So I think that's really important as well. So be open, be flexible, listen to what they have to say, offer your opinion, but ultimately, try to absorb it all in and try to make a fully informed, educated decision on your health care. All right, the next is to be respectful of your healthcare provider and their staff. They work very, very hard on your behalf, so it's really important to know that they're there to help you, and they will help you. So just be respectful of their time, and your needs are very important, and they are going to make that a priority, but I think that's just something that's very important as well. Okay, number 10 is to bring a friend or family member with you as a patient advocate. So if you have something serious going on, or you have a big decision to make, like about a surgery, or you're getting into cancer treatment, or you're going to get an experimental drug, then it's really important to bring somebody with you, because 2 ears are better than 1, and they can help you process that information a lot better. So definitely bring somebody with you, a husband, boyfriend, friend, parent, colleague, anybody that can help you ask those questions, keep things streamlined and organized, and help you process everything. So I hope that this has been helpful. I'm glad to see you guys have joined in today, and I'll try to give you some more helpful tips in the future. So thanks a lot. Have a great evening. Bye-bye.